Hey, it's time for an apple fritter. Here's your host, Jimmy Apple.
Welcome to another episode of An Apple a Day's the Fritter. My name is Dave and I'll be filling in for Jimmy Apple today. What is coronary heart disease? Heart disease is a catch-all phrase for a variety of conditions that affect the heart structure and how it works. Coronary heart disease is a type of disease where the arteries of the heart cannot deliver enough oxygen-rich blood to the heart. It is the leading cause of death in the United States. About 18.2 million American adults have this disease, making it the most common type of heart disease in the United States, according to the Centers for Disease Control and Prevention. Coronary artery disease affects the larger arteries on the surface of the heart. Another type of heart disease, called coronary microvascular disease, affects the tiny arteries in the heart muscle. Coronary microvascular disease is more common in women. The cause of coronary heart disease depends on the type. Coronary artery disease is often caused by cholesterol, a waxy substance that builds up inside the lining of the coronary arteries, forming plaque. This buildup can partially or totally block blood flow in the large arteries of the heart. Coronary microvascular disease happens when the heart's tiny blood vessels do not work normally. For most people, coronary heart disease is preventable with a heart-healthy lifestyle. Symptoms of the disease may be different from person to person even if they have the same type of coronary heart disease. However, because many people have no symptoms, they do not know they have the disease until they have chest pain, blood flow to the heart is blocked causing a heart attack, or the heart suddenly stops working, also known as cardiac arrest. If you have coronary heart disease, you may need heart-healthy lifestyle changes, medicines, surgery, or a combination of these approaches to your condition and prevent serious problems. Sometimes coronary heart disease, CAD, is silent, meaning you may not have any symptoms until you experience a heart attack or other complication. This can make the disease hard to diagnose before a problem occurs. And it is also why preventing heart disease is so important. Symptoms of a heart attack. A sudden heart problem, such as a heart attack, may cause the following symptoms. Angina, or chest pain caused by the heart, can feel like pressure, squeezing, indigestion, burning, or tightness, and is sometimes related to physical activity. The pain or discomfort usually starts behind the breastbone, but it can also occur in the arms, shoulders, jaw, throat, or back. Cold sweats, dizziness, lightheadedness, nausea or a feeling of indigestion, neck pain, shortness of breath, especially with activity, sleep disturbances, weakness. Women are less likely than men to experience chest pain with a heart attack. Instead, they are more likely to experience dizziness, extreme tiredness, nausea, pressure or tightness in the chest, stomach pain. You may also have some symptoms of a sudden heart problem, such as chest pain, shortness of breath, or neck pain, that go away with rest and come back with activity. These symptoms may get worse as the buildup of plaque continues to narrow the coronary arteries. Chest pain or discomfort that does not go away or happens more often or while you are resting might be a sign of a heart attack. If you do not know whether your chest pain is angina or a heart attack, call 911 right away. All chest pain should be checked by a healthcare provider. What raises your risk of heart disease? Your risk of coronary heart disease goes up based on the number of risk factors you have and how serious they are. Some risk factors, such as high blood pressure and high blood cholesterol, can be changed through heart-healthy lifestyle changes. Other risk factors, such as your sex, older age, family history, and race and ethnicity, cannot be changed. Age. Genetic or lifestyle factors cause plaque to build up in your arteries as you age. Also, changes in the small blood vessels of the heart as you age raise the risk for coronary microvascular disease. In men, the risk for the disease starts to increase around age 45. Before menopause, women have a lower risk of coronary heart disease than men. After around age 55, the risk for women goes up. This is likely because women have less estrogen, a female hormone, after menopause. Air pollution in the environment can put you at higher risk of this disease. The increase in risk may be higher in older adults, women, and people who have diabetes or obesity. Air pollution may cause or worsen other conditions that are known to increase your risk of coronary heart disease, such as atherosclerosis and high blood pressure. Your work can raise your risk if you are exposed to toxins, radiation, or other hazards, have a lot of stress at work, sit for long periods, work more than 55 hours a week, or work long, irregular, or night shifts that affect your sleep. A family history of early heart disease is a risk factor for coronary heart disease. This is especially true if your father or brother was diagnosed before age 55, or if your mother or sister was diagnosed before age 65. Research shows that some genes are linked with a higher risk for the disease. Over time, unhealthy lifestyle habits increase your risk of this disease because they can lead to plaque buildup in the heart's blood vessels. Being physically inactive can worsen other heart disease risk factors, such as high blood cholesterol and triglycerides levels, high blood pressure, diabetes and prediabetes external link, and overweight and obesity. Not getting enough good quality sleep, including waking up often throughout the night, may raise your risk of coronary heart disease. While you sleep, your blood pressure and heart rate fall. Your heart does not work as hard as it does when you are awake. As you begin to wake up, your blood pressure and heart rate increase to the same levels as when you are awake and relaxed. Waking up suddenly can cause a sharp increase in blood pressure and heart rate, which has been linked to chest pain related to the heart called angina and heart attacks. Smoking or long-term exposure to secondhand smoke can damage the blood vessels. Stress can cause your arteries to tighten. Stress may also indirectly raise your risk of coronary heart disease if it makes you more likely to smoke or overeat foods high in fat and added sugars. Unhealthy eating patterns include consuming high amounts of saturated fats and refined carbohydrates, such as white bread, pasta, and white rice, can lead to overweight and obesity, high blood cholesterol, atherosclerosis, and plaque buildup in the heart's arteries. Other medical conditions affecting your heart and blood vessels can raise your risk of developing coronary heart disease, including atherosclerosis, congenital coronary artery defects, heart problems you are born with, high blood LDL cholesterol, sometimes called bad cholesterol, high blood pressure, high blood triglycerides. There are also several medical conditions that are not directly related to your heart and blood vessels that may increase your risk for the disease, such as autoimmune and inflammatory diseases, such as Crohn's disease, ulcerative colitis, psoriasis, lichen planus, pemphigus, histiocytosis, lupus erythematosus, and rheumatoid arthritis, chronic kidney disease, diabetes, HIV, AIDS, especially among older adults. Part of the risk might be due to side effects of HIV treatments. Mental health conditions, including anxiety, depression, and post-traumatic stress disorder, PTSD, metabolic syndrome, overweight and obesity, sleep disorders, such as sleep apnea or sleep deprivation and deficiency. Coronary heart disease is the leading cause of death for people of most racial and ethnic groups in the United States, including African Americans and whites. For Hispanics, Asian Americans or Pacific Islanders, and American Indians or Alaska Natives, heart disease is second only to cancer. People of South Asian ancestry are at higher risk of developing the disease and serious complications than other Asian Americans. Sex. This disease affects men and women. Obstructive coronary artery disease is more common in men. However, non-obstructive coronary artery disease is more common in women. Since the non-obstructive type is harder to diagnose, women may not be diagnosed and treated as quickly as men. If you are a woman having chest discomfort or shortness of breath during physical activity, ask your doctor about tests to check for non-obstructive coronary artery disease or coronary microvascular disease. Learn about more conditions that increase risk for women. Coronary heart disease is largely preventable. Studies show that heart-healthy living, never smoking or quitting smoking if you do smoke, eating healthy, and being physically active throughout life can prevent coronary heart disease and its complications. A heart-healthy lifestyle is important for people of all ages. But it is especially important for anyone who has other risk factors for heart disease. Work with your healthcare provider to set up a plan that works for you based on your lifestyle, your home and neighborhood environments, and your culture. This may mean taking steps to improve your diet, get physically active, manage other medical conditions, and help you quit smoking. Thank you for stopping by today, and remember, there is a new apple fritter every day, Monday through Friday. Jimmy will be back with you tomorrow. And please remember, no one ever went blind by looking at thin MGS from the bright side, so give it a shot. And please, try to be the reason somebody smiles today. Have a great day.
Join Jimmy tomorrow for another apple fritter. In the meantime, stop over at our YouTube group page, Living with a Disability, join in the conversation and make some new friends. See you next time.